So polio is essentially a clinical syndrome that's caused by the polio virus. So the symptoms of polio for the vast majority of people that get a polio infection are actually no symptoms or asymptomatic. So maybe 70 to 80% of people that are infected with this virus would not even realize it. There are a subset of people that maybe 10 to 15% that when they do develop symptoms, they're what we would consider flu-like symptoms. So malaise, fatigue, some generalized feeling of unwell, maybe nausea or vomiting, that basically sort of makes you think you have the flu, but it could be a polio infection. And then in a very small number of people, we get sort of the more dreaded complications of polio, which could lead to something like paralysis. So the reason that polio produces paralysis in only some people is not fully understood, except for the fact that there may be some immune related reasons for it. For example, we tend to see paralytic type complications from polio in children or kids that are five and under, as an example, or even adolescents. So that suggests that maybe it has to do with the host or the person's immune response that may be contributing to that. As far as proportion, paralysis happens in approximately 1 in 200 cases. So it's not a very common finding, but it is the dreaded complication, unfortunately, of the virus.